Thank you very much. I appreciate tremendously being asked to speak to the Mini Medical School. Ricardo and Rosita, I want to thank you for your gifts to allow this to exist, because so many people, I think, find value in it. And it's through your generosity that we're able to do this. As I look out at the audience, I see my age. This is good. I see my age plus a little bit in a few people. And that's good too. Because through my career doing pediatric orthopedics, and I also have specialty in oncology. I did a fellowship in musculoskeletal oncology, which is tumor care, as you know. I've learned a lot about how things change, how disease can change us, how time can change our physical beings and our musculoskeletal system, but also wanting to keep it as healthy and young as possible to allow us in our lives to function, to do the things that we want to do. We've gained in time, sometimes more resource to do things, more time. We worked so hard when we were younger, we didn't have all the time, but now we might have some, so we want to be as healthy as we can to be able to use it functionally. So I'm going to talk about what happens with age in the musculoskeletal system, and in doing that, try to help all of you to understand a little bit how you might be able to modify it, improve it, change it, and not as a single thing like go exercise, but actually fundamentally why, what muscle groups might be really important, and we'll go through some of that, and then I want to leave time for questions. So as we age, certain things decrease, and I'm going to go through each of these so that you have an opportunity to understand what they are. So the first one is strength, and I think most of us understand what it means to have strength. So strength really is related to single muscle function, an alignment of a joint, alignment of our bodies, and then the muscles functioning as lever systems. There's an origin where the muscle begins. There's an insertion where it attaches. So we'll just use biceps, a two-headed muscle, which is why it's biceps. And then in the back of our arm is triceps, because it's a three-headed muscle like a tricycle with three wheels. When I finally started learning some of these words in medical school, it's like, God, it was so complicated, and now I can understand why we call it quadriceps. There's four heads. So it's like, hello, now I get it. Okay, so with a single muscle, we'll talk about biceps, this muscle in the front of our arm. The strength I think of describing best is if I have weight in my hand against gravity, and I want to see the strength of that biceps. What I want to do is understand how much weight or how much resistance to gravity I can lift up with that muscle. So that's what I think of as strength. But there's concentric strength and isometric strength and eccentric strength. Oh, here we go, problem. Okay, so concentric strength means that the muscle is becoming more concise or short. So if I am shortening the muscle, I'm contracting it, so concentric contract, shortening the muscle, so it would be the weight in my hand and I'm lifting the weight up, that's concentric shortening. Okay, now the physical trainer will say to us, now take the weight and hold it right here. I'm like, okay, it should be easy. After a few minutes, it's not easy. And that is isometric. Isometric meaning it's not changing length. It's sitting at one length of the muscle unit and it's just holding. That's a different type of strength. If I stand up straight, tighten up my thighs to make my legs be really straight, hold all my muscles really tight, that's an isometric strengthening. And when you hold something, you actually can strengthen the muscle. So that's important. Third one. This one is one that we didn't understand for the longest time. And it was interesting story that it was when we started getting, the US started getting their butts kicked in the Olympics, by some of the Eastern European countries, we thought it was all drugs. Well, it was some, but it also was they had developed some strengthening programs that were different than ours, and some of it involved eccentric strengthening. Eccentric means elongating. I take the weight in my hand. I pull the weight up. I go to an isometric point and I hold it. Now, I take the weight and I slowly lower it. The muscle is elongating while I'm slowly lowering. That is a very powerful strengthening maneuver. So in reality, when we train with weight to get increased strength, we need all three. Because injury comes frequently when a muscle is rapidly elongating and tears. But if you have eccentrically trained it, it won't tear. The muscle has been conditioned, it knows how to handle that lengthening, and instead of tearing, it actually allows the movement, and you've got strength through the range of motion. Those three things are important. So with your personal trainers, in your exercise programs, I want you to think about strengthening and the three types and how you might be incorporating those in your work. Okay, now we're going to move to the next one, flexibility. Again, I think most of us understand what flexibility is. It's that each joint has a certain range of motion. There is a book that the Social Security Administration puts out, if I'm going to do a disability exam, that tells me what a normal range of motion is for every single joint in the body. When I was doing those exams to earn extra money as a resident, I was like, I cannot possibly remember all these range of motions. But then I would sit there and do my own, and I sort of knew what it was. But that's important to understand. What is your range of motion of each joint? So it's important because as we age, if we haven't done much for flexibility, if we've worked on all strength, we usually have lost flexibility and we begin to lose range. The use it or lose it, I want you to embed that in your brain. And that is not fixed in time. What body I have today, I will not have tomorrow. Now, it could be worse, but it can be better. It actually is uplifting for me to think that, because the system of the musculoskeletal organ responds to use of it through these characteristics. So if I slowly improve my range, you asked me earlier about the stretch lab that's here in town. It seems to be a new hot fad, but it's trying to work on flexibility. Now, muscle, there's a type of stretching that can be done, that you can learn to do, which is called PNF stretching, or peripheral neurofacilitated stretching. You're like, oh God, that's like, woo! Okay, straightforward concept. Here we go. Okay, I take a muscle, and muscles are fibers, right? And the fibers are linked together like crossing my fingers. And between those fibers, if you look at the structure of it, it's these tiny little arms that reach up, grab the other fiber, and pull. And there's actin, myosin type, different ways that this works. But we're going to think about this crisscrossing like this. Can everybody see this? Okay, so when I contract a muscle, I actually pull those fibers and knit this together more. Okay, now when I hold something really strongly, I'm using the muscle, I'm tightening it up, and then I let it go. So the muscle's been used, and when you let go, there's an increased relaxation. So if I'm trying to stretch my shoulder and I'm pushing my shoulder forward, using this pectoralis muscle, and then I let it go, I get increased range. So it's a technique you can use, usually with someone helping you. But after that muscle lets go, the next thing that's related to flexibility is around every joint is a capsule. It's a fibrous structure. It's the gristle when you look at a piece of chicken that's holding the thing together, right? And so that actually can also tighten up. Frozen shoulder is not muscle usually, it's actually capsule. So once you get past muscle range, you have to very slowly work on capsule because the tissue is much more dense. Scar tissue is like that. When we've been injured, we get scar. And we think of scars like linearly along our arms from your fall and your surgery. But in reality, a scar doesn't just go along the skin. The scar goes all the way down to where the injury is, and it goes all the way down to where I operated as the surgeon. So there's a tissue is supposed to move over itself. If you take your arm, I want you all to do this, and I want you to kind of move the skin on the back of our arm. Mine moves more than I want it to. But what I can see is that the skin is moving over the structures underneath. The tendons and things underneath, it's meant to be that way. We're meant to be like baklava, we can slide. Okay, but when we get scar, it starts to knit all that together. And as you move, you need that gliding. So that's where this tissue massage that people do, and people ask about massage, it can actually indent the muscle while the person's rubbing, which elongates it, and it can actually help to break up scar. Now, if you push too hard, if you don't know what you're doing, and you like go after it, you'll cause harm. You'll tear it, and it'll swell and be inflamed, and then you set yourself back. So don't do that. You want this gentle movement. My son and I were talking about this. My mother always told me, little by little, you can go a long way. That's true physically, and it's true emotionally. So this musculoskeletal work that you all want to learn about and do, you have to be kind to yourself and understand it's not all going to change tomorrow. You've got years of whatever you've done before. But if you take these things and sort of incorporate them gently, little by little, then you can go a long way. Okay, flexibility. It's very important. If one of us is, I'll give you an example. I was wearing flowy pants, and I caught my toe in the pant. Bad move. My son was sitting there watching me. He's like, oh no, Mom. Totally. Whack! Down I go. I have pretty good flexibility. I was able to move fast enough, had enough strength and bone density, and enough flexibility that I could get myself caught before I hit the ground and didn't break anything. That flexibility and range of motion becomes important as we have increased fall risk. Fall risk, clothing that can get in the way, shoes that are untied, throw rugs in our house, trying to carry too many things at one time. I think we need to be more cognizant of this as we age because they're just going to present as obstacles. Now we're going to go forward to the next one, which is also really important. Now I've got the word balance there, but I've put the fancy word underneath it for what it really is. Okay, balance, I'm going to have you think about what proprioception is. How many people in the room know the word proprioception and feel like they understand it? Good start. Okay. Now, for those who don't, I want you to put your hand out in space. Pick a hand. I know where my hand is. I can see it, right? Now, what I'm going to have you do is I'm going to have you close your eyes. Close your eyes. Move your hand a little bit as your eyes are closed. You still know where your hand is in space, correct? Okay. That is proprioception. Now, what I want you to do before you stop, take your other hand on one, and I want you to put your second hand on top of your first hand. Now, as you're touching it, you know more where it is, correct? Yes, okay, you can open your eyes. Hands can go down. Okay, there is a whole system in our body, a proprioceptive tract that exists that I never knew anything about till I went to medical school. And that is telling our body where we are in space, and I don't have to look, I know where I am. I know I'm on the ground, I know what height, I know what step is coming, I can anticipate it. Have you ever missed a step before? Do you know how much that jars you with just one step? Either it's too much or too little. Your proprioception, you had one idea about what it was, and you had another about what hit your body. And it's very abrupt, and it's painful frequently. So proprioception is knowing where my body is in space, and it can be amplified and trained. If I'm standing on one leg, I'm using my eyes a lot, and I'm using my muscle, and I'm balancing. Now, if I close my eyes, I have to use much more proprioception. That is an activity that we actually should be doing. Now, it's hard. The first time you do it, if the light's low in a yoga class or you can't see as well, you'll find it's much harder. So do something for yourself if you're going to work on that, and put the hand on something that's static so that you can know where you are. You've got a feedback loop from something you're touching, and it's much easier to do that. Now, how many people have seen athletes with kinesio tape on them? All this tape all over their bodies. You're like, what the heck are they doing? They like the color, they like the pattern. Okay, kinesio tape is taking advantage of proprioception, of tactile feedback. So let's just say I have a shoulder injury, and when I get in a certain range, that causes me pain. So if I use kinesio tape along the back of my arm, when I reach forward, this tape is going to pull, and it's going to remind me by proprioception that I want to pull my arm back, not let it go too far forward. Taping the ankle of a 300-pound lineman. You see it all the time, or they wear a brace on their ankle. You think that tape's going to hold a 300-pounder? And no way. Taped ankles when I was young for athletes, and I'm like, I don't understand. Well, it's the power of proprioception. I'm 300 pounds, I'm a lineman, I've got tape on my ankle. I've sprained my ankle a billion times. I'm stepping on the line and my ankle starts to twist, the bad position that will cause the fracture or the sprain. I feel the tape on my ankle. And now I'm 300 pounds and I can use all my muscle force to pull it into the right alignment. It's body position in space. So things that work on balance, with and without vision, with and without tactile feedback, is very important for us. There is one activity that has actually, in a study, been shown to decrease fractures. One sport, one thing. Any idea what it might be? It's Tai Chi. You're like, what? Like I don't get a bunch of bone density with Tai Chi, but what I get is amplification of proprioception, movement of my body in space, controlling my movements and fall, set patterns of movement, and balance, so that I fall less. You fall less, you break less. So activities that help your balance. You will not probably find one activity that's going to do all 5 of these. But what I want to do is make sure I fundamentally explain the 5, and then we're going to go rapidly through some other stuff. But these 5 are so critical, I want you to feel like I know these 5. And then what you like to do for sports, you're going to figure out, checkbox, that one gives me some strength. Checkbox, that one gives me some balance. Checkbox, I get power out of this one. So you get all of them through the things you love to do, and it's not one thing. Don't believe the marketing. Okay? Next one, endurance. And I think we all know what that is, and we lose it as we age. It's the ability to sustain an activity through time and continue to do it. And that's cardiovascular fitness that goes into that, both aerobic, meaning with air, and anaerobic, meaning without air, the shortness of breath from climbing stairs. So endurance is really important because you want to be able to sustain an activity through some time. And so you're going to have to pick something. And I tend to pick something that I can do for a while without pain as my endurance. Some cardiovascular something for my endurance. And I can always tell you if I've been working on one thing and not another, how one of them is not keeping up and I need to work on that one more. That's okay, it's not bad. I just need to change my plan. Okay, endurance, that one's pretty straightforward. Walking extended distances, if you like to jog, if you want to get on an elliptical trainer, if you like to get on a bike and ride some, you really, I think of that, endurance as being able to do this activity and actually do it with some sustained time. Okay, power. Now this one's different. This one's different, and this one's important. Okay, there are slow twitch muscles and fast twitch muscles. Okay, something else I didn't know before medical school. Okay, slow twitch muscles, I think of as muscles, they really just cross a single joint. They're big and beefy, and they're meant for strength. You look at like a lifter, and you look at their calves, somebody that does a lot of big weight, and their calves are really big. That muscle underneath here in our calf is called the soleus. It just comes from the calf, it goes across, it's part of the Achilles mechanism, but it's slow twitch. It's just, I think of it as just strength. Now, there's a mixture in this, so I'm trying to give the fundamental levels of this. The fast twitch muscle, look at a sprinter's leg. Sprinter's legs, the calf's not very big. You're like, what the heck? How come they are so fast? Well, the gastroc muscle, the two little muscles in the back of your leg, are fast twitch. They cross my knee and they cross my ankle. When one activity happens, the next is supposed to happen. What we lose most with aging between the two muscles is actually fast twitch, the thing that responds quickly. You always say to yourself, like, I can't respond as fast as I used to. This is this loss of fast twitch. So, power, this combination of an explosive force. I have a weight, I'm holding it on my shoulders, I go down, but I come up fast. I come up fast and I go up on my toes. I'm trying to build some explosive power. That's an important component in the strength component, is to have this ability to do some exercises that actually are building your fast twitch. I wish we had a week clinic to do this, because then we'd go through and we'd learn things in every bucket. But that's one that whatever your training program is, something that gives you power. I want you all to, if you have a walker or something, I want you to be careful with this, but I'd like everybody to pull their chairs back out and to stand up and push the chair back behind you. And you're welcome to hold on to something if you want to. It's good to take a break, because it's hard to sit here and listen to somebody for too long anyway. Okay, now what I'd like you to do is to sit down on your chair and then stand back up. And you can actually sit all the way down and then stand back up. Now what we're going to do is we are going to sit down, but we're not going to let our backside actually hit the seat. We're going to come close to it, and then we're going to stand back up. Now, you can all take a seat. One of the exercises that has been something that people feel is very helpful, and we can do almost any place we are, is how many of those sit to stand can you do in 60 seconds? And there are some numbers that will let you know where you are in your strength in sit to stand. And sit to stand in life for us as we're older is hugely important for function and independence. Because if I can sit to stand, I can take care of my personal hygiene on my own. If I can't get down in a chair and get up out of the chair by myself, I can't be as independent. So I will fight as long as I can in my life to keep doing chair pose in yoga, which I hate, because I know that will help to build sit to stand strength. Okay, does everybody feel like they have a strong handle on these 5 things? Okay, we're going to go through slides now. Okay, for all those things that I'm losing, I have gratitude as I get older. That's something I've gained. And practicing gratitude is what my mother-in-law and my mother taught me to do. And as I've gotten older, practicing gratitude has gotten better and easier, but it is a practice just like my musculoskeletal one. And these things are the ones that I feel like we potentially gain with age. I think we're more mindful. We have more knowledge. We can be more patient. I tell myself that in traffic. I feel like I have compassion in our own lives and our own families. Any suffering that we've seen, experienced, or losses teach us how others might feel and to have compassion for them. Empathy. I understand how you feel, and I want to be here to help you. I can be more empathetic. And in all of that together, I feel like I have slightly more wisdom, slightly. And I know that this room is full of these components, and we can use that in our ohana to take care of one another, and that gives me purpose. And purpose makes me feel like I'm supposed to be here. Okay, now we're back to the science. Okay, remember when you were in math, young, and we had to learn about X, Y, and Z axis in mathematics? And I'm like, oh God, okay. Now, the thing that's really important is X, Y, and Z axis actually converts to the planes of the body. And if we have all three axes, we actually three-dimensionally can map something in space. Now, we're going to go to our skeleton. So, what we have is, in the old days, especially in orthopedics, we would look at an X-ray, a film that was taken of somebody laying down, and we would look at a picture. And it is basically from anterior to posterior, from front to back. It's a single plane, and that plane is the frontal plane. Now, the human body, against gravity, this is critical. This point is very important. You're trying to keep your head centered and aligned over a spot in space, which happens to be where the pole in this skeleton goes. In every skeleton, either one hanging or one on a post, you can see where the post comes out just in front of this part of the body, which is called the sacrum, within the pelvis. I'm trying to hold myself centered in the frontal plane with head over S2. Sacrum is 1, 2, 3, 4, 5, like we number them, but they're all fused together in this bone that looks kind of like a big triangle back here. This is our sacrum, okay? So this is the cervical spine. This is the thoracic spine, okay? Thoracic spine is defined by it has ribs attached to it. It's a cage. It's there because it's trying to protect heart and lungs. It's not nearly as flexible as the other part of the skeleton. Cervical spine is meant to hold our head over that thorax. And so this part of our body has a lot more movement in all these planes. I can flex it, I can extend it, I can laterally bend it, and I can rotate it. Those planes, and we lose those as we age, but keeping that range is really important because it's allowing your head to visually move and to help to hold you upright. The thoracic spine is the one that's actually protecting your heart and lungs and creating a cage around it. Then there's the lumbar spine. Lumbar, this area, like a lumbar support or a lumbar corset, is because these are lumbar vertebrae. The movement of the lumbar vertebra, if I look at the articulations or the connections between each of this vertebra, they're aligned like this. So they're going to move like this. So primarily I can flex and extend because that's what those facets, those connections are going to allow me to do. Thoracic spine, they're like this. They're in this frontal plane. They're going to allow some lateral bending, but they're not going to allow too much compression or extension because they're meant to protect the cage. And then we get down to the sacral part where I was just talking about, and that little one sits right here as a solid mass of bone to connect the pelvis together as a ring. So frontal plane, it's just like you're looking at me. My head is trying to stay centered over S2. If I get my head too far forward or too far back, I'm out of the plane. Now let's go next plane. Sagittal plane. That one's a little hard. Okay, sagittal plane, our friend has turned sideways. We've done a 90-degree view to our frontal plane. Now, if you look at that, you can see that the spine isn't straight. It has curves in it. The cervical spine curves like this. That's called lordosis, like the letter L. The thoracic spine has a little bit of this, kyphosis. Now, too much kyphosis and I look like I've aged. I've gotten myself out of the correct sagittal alignment. My body is collapsing forward. When that happens, I have to use a lot of energy in the muscles in the back to hold me up. I'm compressing heart and lung. It is not ideal. Lumbar spine, lordosis in the sagittal plane. It goes this way again. And then the little sacrum goes back, just like the thoracic spine, kyphosis. Lordosis, kyphosis, lordosis, kyphosis. So it's this S shape that our body's naturally supposed to have. Too much of any of those curves, bad news. Then everything's going to have to compensate for it. You're trying to keep in your sagittal plane your head centered over S2. You're not to let your head get forward, and you don't want your body weight way back. You want to be balanced, head over S2. Last plane, the Z-axis. This is this rotational axis, like I've sliced you this way, like a loaf of bread. So if I'm rotated too far forward, I'm out of the head centered over S2, and I'm going to have to compensate for it by bringing something back around. So I'm using a lot of energy and muscle force if I'm out of my axial balance. So frontal plane, sagittal plane, axial plane. Now, I happen to have trained in medicine when CT scan came into being, believe it or not. It was one of the first classes that we had axial anatomy because we had to learn. So a CAT scan, which is a computerized axial tomography, wow, who knew what that was, right? Was a way of taking an X-ray, and instead of taking it like front to back or from the side, they took it in tiny slices. And actually, it moved forward in time, so it wasn't just slices, it was helical slices. And if you take anything in all three axes, you can then put it back together and make it three-dimensional image. That's what a CAT scan is. It is best for bone density. It's like an X-ray. It's best for things that are dense. So sometimes I have to get on the phone with the insurance company. I'm like, yeah, they need an MRI and they need a CAT scan. And they're like, well, we'll pick one. Well, I'm like, I'm sorry, they need both. CAT scan's really good for bone density. We use it now a lot for abdomen too. But if I want to look at soft tissues, detail as a tumor surgeon, I may want a CT scan to look at the bone, but I certainly want an MRI, a magnetic resonance image, where I'm actually using a magnet to spin water molecules, spin and unspin them, and they have different characteristics depending on what the tissue is, and it gives you a whole different picture. So that's why there are different images that we use, and that's why doctors have to get on the phone and explain that to people in the insurance industry. Okay, lordosis, that's this curve of our lumbar spine, this kind of swaying of the back. This image is meant to show someone with too much lordosis. Now you see what happens when there's too much lordosis in this image? Your belly is kind of not holding you up. You're standing with this sway back. You're kind of leaning like this. The problem with this is I'm not holding my head centered over S2. I'm just collapsing back. And when you collapse back like that, you put lots of force on these facets, these connections between the vertebrae of the lumbar spine. It is probably why the human condition of crossing our arms when I'm bored and listening to a lecture like this, and I'm just sitting here leaning back listening to it, how many times I did that in medical school. And you're really loading up these lumbar facets, and over time, if you load them, they get arthritic, they enlarge, they get osteophytes. And the little nerve roots that are important for function of my bowel, bladder, lower extremities come out of the lumbar spine through these holes right here. These are called foramina. So if I've loaded up these facets all my life, which I certainly did, and I've gotten them enlarged from being lazy, then I'm actually going to start building osteophytes, and they're going to pinch the lumbar nerve roots, and I'm going to get sciatica and all kinds of spine problems. But one of the ways, and the first thing we do before we ever operate on someone's spine, is we go back to, if I look at that picture, the thing that should happen with that is to strengthen the core. If I strengthen my core And in this case, core is not just the front muscles, but we're going to think of the front muscles. But if I strengthen these obliques on the side and this in the front, as well as the erector spinae, the muscles in the back, so it's a barrel hoop kind of force, then I can hold myself up without loading the lumbar facets. So if you're standing and you're just kind of letting your gut hang out and you're kind of just balancing back like this, that's going to create increased back problems. And it's going to put you out of the right balance. So strengthening your core and every other thing we do, our shoulder muscles, our hips, everything is hung on our core. So it is the foundational thing for working on our upright posture. Kyphosis, likewise, is not excessive leaning forward. So let's just take, it most commonly happens in we as women. We lose bone density, we lose estrogen over time, our bones can get softer, we have a lot of conditions in women. We're also starting to discover that men are having the same condition. We just didn't know to the same degree. But as we lose bone density, the vertebra here with increased, they're naturally in a little kyphosis. But if this vertebra, this wedge, this bodies, these building blocks are soft, then as we lean forward with time, these vertebrae begin to get wedged and compressed. And we get compression fractures. And we get increased kyphosis. Women, we do not naturally have as much strength in our backs as most men. And over time, we're not taught to strengthen that. In fact, from the time we're teens and embarrassed, we kind of put our hair like this and we go like that. That's why you tell your grandkids and your kids stand up straight. What you're needing to do is to lift your sternum, your part of your chest right here, the breastbone. You're supposed to lift that sternum up. You're supposed to take these shoulder blades, and this is a trick I want every one of you to do. I want you to think of your shoulder blades. This is your scapula, okay? And there's a point on the bottom of it. I want you to take your scapula and I want you to put it in your back pockets. I want you to take your shoulders, lift them up and back and drop them in your pockets. Life right now is a kyphosing experience. We're at our computers, we're watching TV, we're in a comfy chair, we're on the sofa, we're being couch potatoes. We're driving. We're forward. You get in your car, remember, scapula in my back pocket. Up and back and put them in your pocket and get your sternum up. And just that little cue for yourself will help you start to build some of the strength that is back here. We as women, I believe, need to really begin to focus on this back strength so that we can work against what gravity's doing to us. Okay. So those two are important. I already mentioned this to you that the spine with the cervical, thoracic, lumbar, and sacral have the four, they go lordosis, kyphosis, and the gentle S balances my head over my sacrum. Any increase in any one of those, and we're going to be out of alignment. The head needs to be centered in the frontal plane, in the sagittal plane, and in the transverse plane over my sacrum. There is a line, and you, at any point, whatever you're doing, you can think about this alignment and you can adjust yourself proprioceptively. And just those little changes can begin to make changes in our body, increase the strength, increase the flexibility. Okay, at every muscle group, at every joint group, that we're upright against gravity. And this is what makes us unique as human beings. There's no other animal that is completely upright against gravity. If you look at primates, they actually have a body position that they're like this. So the only animal that comes completely upright against gravity is us. Now, I would know if somebody gave me this complete skeleton, that this was a human skeleton and not a primate skeleton. And I was always like, well, how do they know that? Well, when you want to go upright against gravity, let's imagine the Eiffel Tower. It's this magnificent up against gravity structure. Anybody in here an engineer? Builder? Okay. If you want to go upright against gravity and you don't have a material that can handle the force, you look at old churches and things. What they did is they made buttresses. If you were gouty and brilliant as he is, you would take that buttress and you would reverse it and you would build the Familia Sagrada in Santander, Spain, because he knew he could go upright against gravity if he buttressed one arch against the other or built it classically like an arch. So if I look at these vertebrae and I look at something called the pedicles at each level, in a human being, they start narrow and they widen at the bottom. They are like the Eiffel Tower. Because anything organic, a plant, a tree, anything that's holding itself, that can change its shape against gravity, the trunk is shaped like a buttress. The plant is shaped, the leaves, the petals, everything like a buttress. And you start thinking about that and you're just like, oh my God, you are amazing. And everything that we make is very linear. So if I see linear things in the body, it's a fracture. If I see buttresses and symmetry, I know it's the way it came. That's probably the most profound thing I can tell you. Now, the anti-gravity muscle at my hip, to hold myself up against gravity, if I take my head and I drop it forward, I'm now not balanced with my head over S2, right? I've gone forward. So the muscle that can hold me up against gravity at my hip is my glute max. That's why the thing is so big. I love giving it that credit, okay? So that muscle goes from the back to our legs and it's a sling and it holds us up. That muscle is very important to build its strength as we age. So taking weight and leaning forward and pulling it up, keeping my back straight, I don't want to use my back, but I can begin to work on my glute max. And then I can have an anti-gravity muscle that's stronger to hold me up against gravity, so that if I get out of balance and I fall forward, I can pull myself back up. Okay. Now, the knee joint is also an anti-gravity muscle. And it is happiest and using the least amount of muscle. I want you guys all to stand up again. And for those of you, as you're standing, I want you to just squat just a tiny bit, just to crouch a tiny bit. Can you feel as you put your hands on your thighs what has happened? You have had to use your quadriceps in the front to hold you up. Now, keeping your hands on your thighs, go all the way up, push your legs super straight, and let your quadriceps go like jello. Can you see how you can make it super loose when you're standing there with your body weight kind of like slightly forward? What's happened is you've taken your body weight forward, you can shut your quad off. But crouching, that thing we just did, the quad has to work. So this is the anti-gravity muscle at the knee. You guys can all have a seat, keep going down. Okay, that muscle is critical. Again, chair pose, the things we were talking about with endurance and strength, to be able to allow you to go against gravity. And I'm eccentrically working the quad here, like it's elongating as I'm going down. So it's working. And then it's isometric here. And then when I straighten my knee, it's concentric. So slow down, hold it, and up. I'm working my quad. Very important anti-gravity muscle. I'm going to do one last muscle, then I'm going to stop because I want to give us time for questions. Okay, the last anti-gravity muscle, I'll do two. The last anti-gravity muscle is at the ankle. And this is a fascinating muscle. Remember I told you the soleus was a slow twitch? That's the deeper muscle underneath. And you see where it shows calf muscle, the two little muscles? That's your gastroc. So the reason Achilles is called triceps surae, triceps, is there are three muscles. The soleus underneath and two gastrocs, triceps surae. So that is the anti-gravity muscle at the ankle. It prevents me from collapsing forward. It holds me, it pushes me up against gravity. which is a hard concept to understand and would take a little bit more of a lecture. But trust me, that's the anti-gravity muscle. Now, it's also called the Achilles. So that is your Achilles tendon. Now, in the mythology of Achilles, he had Achilles' heel. Okay? So why would that be a weak spot for him? I never understood that until I understood the function of the gastroc soleus and the triceps suri and my Achilles tendon. It is holding me up against gravity. It's the one muscle that if I shut off, I can't stand up. So if I damage my Achilles, I will fall forward. I won't be able to stand, and I won't be able to run. And in mythology, you would kill him if you damaged his Achilles tendon. So this tendon is extremely important. And flexibility, because it can get inflamed from overuse and not having good range of motion. And it can rupture. There's lots of Achilles. We see it in athletes in the sports we watch. Now it can be repaired, it can heal on its own if casted right, but it's a very important muscle that's up on your toes and down, up on your toes and down. So beginning to work on strengthening your gastroc soleus, which is standing straight and up and down, and also sitting and raising your toes, that's your soleus. And even putting weight on your lap while you're doing that, that's soleus. So working those is very helpful anti-gravity. So single leg stance, working on my balance, my strength, and my endurance. These exercises are important. Single leg stance, one leg, being able to do single toe rises, holding my balance. I can do the sink while I'm brushing my teeth. I've got the sink right there in case I'm falling. I'm trying to incorporate things that you can do in an easy way. And the last one I really want to tell you about is these. There's glute max, because he's the big guy, but there's two glutes hiding underneath. They're the glutes on the sides. They're the ones that hold me upright in single leg stance. When I stand like this, I don't fall over. So there has to be muscles here that contract and hold me up. If they're weak, my pelvis drops. If they're strong, my pelvis is up. So I can work on standing, looking in the mirror, and being sure this hip's not dropping. And then if it is, I can tighten that muscle up and stay in single leg stance. I can hang on to something, that's fine, but I'm working this muscle. It's the same muscle that you work when you do the ballet lifts to the side. It's your hip abductor. Those muscles, the glute max, medius minimus, quadriceps, gastroc soleus, those are the anti-gravities, really important and should be focused on in the beginning of your strengthening with time. So I'm going to stop because I want to give us some time for questions. Open it up to you, and I want you please afterwards, if there's something I could have done differently, better, explained better, let me know. I'll try to change and tweak and modify so that it's easier to understand. I'm trying to squash all I know in orthopedics in about 60 minutes. Okay, thank you for your attention. Appreciate it.
Thank you so much, Suzanne, for this wonderful hands-on presentation. Aren't you all kind of standing a little bit straighter now? I'm trying really hard. Okay, do you have any questions? Please raise your hands, and online, please type in the chat. I have a question while we're waiting. What good core exercises do you recommend for people? That's a common question that comes up.
That's really good. Okay, so if you we think of them as crunches, but the muscles are more complex than just a crunch. And also we think of like leg lifts, laying down doing leg lifts. So a leg lift, while they're important, they're actually using more of a muscle called the iliopsoas that comes from the spine and the pelvis and attaches to the femur and is the muscle that if I'm going to kick a soccer ball, it's my most powerful hip flexor. So a lot of people will work that muscle or have a really strong hip flexor and they'll substitute it for these muscles. So if I want to work core, I actually, when I lay on my back, bend my knees so that I make it where I can't use my iliopsoas. I'm not going to substitute the one that's strong. The next thing you should do is be sure you push your back all the way to the floor. You can feel your low back pushed against the floor. And when you do that, you want to put your hands, right, the lower part of your pelvis, and as you're pushing your back down, push hard, and what you'll feel is muscles engage in this lower area of your spine, of your belly. That's your transverse abdominis. That's probably one of the fundamental core muscles that's very, very hard to get going, especially like after pregnancy or as we've aged or if we've let our total abdomen get weak. And learning to engage your transverse abdominis and then being able, once my back is engaged and down, then I can pull my core up. And when I'm laying back and doing a sit-up, I'm not trying to crunch my arms to my knees. I'm trying to take my elbows to the ceiling. I'm trying to lift up, not compress my spine, use my core for lift. So without us having a PT session, those muscles are really important. Also, thinking about, I'm standing, and Pilates is a phenomenal core strengthening exercise, by the way. Joe Pilates was brilliant. But what he used to say is head to heel like steel. So what you're doing is you're holding your whole body like a string of pearls. You're holding them long. The vertebrae are coming apart. And I'm using the core to wrap my abdomen and isometrically, scapula in my back pocket, and I'm right now working on my core strengthening. There are other things you can add like Supermans and other, but crossing, those are obliques. And you're going to need to use something to do for all of them. And maybe on a day you can't do them all. Maybe you just do the front ones. Next day you do the side. Next day you do the back. That's okay. Again, my mom, little by little, I can go a long way. And when I'm having a really tough day, I can't. But the next day, I can. And so that is the key, I think, to musculoskeletal health. Form follows function.
Thank you.
I just have a quick question.
Yeah.
Because I have problem walking straight at one time. So the woman who I work with, see once a week for exercises.
Yes.
She said that, since I'm very busy, so she said that just whenever you walk or do whatever, just think about you're using your core, even though you're not really
Yes.
doing it. Does that help?
Yes, it does.
Okay, so
That's those tiny movements that you're incorporating into life. And walking can be difficult as we get much older, and it can become very hard. Balance, some of us have Parkinson's, there's other things going on. So again, thinking about being able to walk forward with the balance to do that, holding my head centered over my pelvis, being able to walk backwards. Now sometimes to do that when you begin, you need to hold on to something. Then you should be able to laterally walk. If you're stronger and working on the next level, you're in crouch while you're walking. So you can take it where you are, and you can just keep adding a little bit to it in your busy life. And that's the goal. That's a really great question.
yeah. So I am better now, but
Probably because you did what your therapist said you're supposed to do.
she's just a trainer, but
Ah.
she has a
Wait.
degree in muscles and stuff like
I'm going to give a plug here. They're trainers. They've been certified and learned how to train people. I have a daughter who has another career, but she's a trainer, so great. There's yoga instructors, there's Pilates. There's a whole discipline of medicine called physical medicine rehabilitation. They are MDs who are trained to rehabilitate our bodies. They do prehab before surgery, because I'm going to make you worse when I operate on you for sure. Not until you're better and do your rehab. And then there's orthopedic surgeons, and our job is usually when it's time for surgery. But the other components of all of this, if we don't work as a team, we can't get you where you need to be. He's going to shoot me for doing this. He's like shaking his head. But my youngest son, Garrett Shoemaker, I'm married to Dean Shoemaker, which is the love of my life. And we have 3 children. And the baby is in the back, Garrett. And he is a PM&R, physical medicine rehabilitation doctor. He's finishing his training. But the goal is to get him home to help take care of us. Because rehab docs are, we don't want surgeries. We actually want rehab doctors. Because surgery is really hard sometimes on us. And sometimes you fall and have a fracture and you have to have it fixed. But we have to do the rehab afterwards or we don't get back to where we were. So I'm doing the plug for all the things that are really important and for you to think about who to use for your help.
I can second that as a geriatrician. The therapists are our best friends.
Absolutely.
And they help our patients function better and keep functioning longer and all of that. So.
And I know that's interesting because geriatricians, I think, really have come to understand and prescribe quite a bit of PT.
Yeah.
Where sometimes other people are like, well, why? One of my partners, why do you need to prescribe PT for your patients? I'm like, oh my God, where have you been? Under a rock? So it's, to me, it is as important as me surgically doing something because I'm cutting into tissue. That creates harm. If you then don't rehabilitate it, you can't ever get back to where you should be. Rehab and prehab are keys to healthy life. Yeah, totally. So I would encourage you, if you listen to this and think, I can't do this by myself, well then reach out to someone who you think can help you. Because having those few lessons that you then take home and do the homework will really help you. And it's fun. My workouts make me feel better emotionally. I think when you're physically working with your body, your mind can clear a little bit, and it's a gift. I took care of a lot of kids with cerebral palsy, and I just thought, my gosh, the kids can't move. I can. I should. Plus, they were just some of the happiest, sweetest patients on the planet, so.
We have time for one last question, if anybody here has a question. If not, thank you again, Dr. Yandow, for a wonderful presentation.
Absolutely.